I first want to thank the members of the steering group for all the work they have done in drafting and promoting the EU Manifesto.
The interesting thing with working in influenza is, and this should be reflected a bit by the work of our team, is it's a multi-stakeholder approach. It's not a national thing, it's an international, transnational thing where we have to get together different countries to come to a solution, because flu is truly a global issue.
As a policymaker, I believe that the manifesto that we have developed together outlines the main actions that we should undertake jointly at European and national level. I'm strongly in favor of recognizing the burden of influenza within the EP resolution, and therefore I've introduced the amendment calling the Commission to establish targeted vaccination initiatives such as a European Influenza Vaccination Day.
This is timely and interesting and necessary as an initiative. What is really striking is that it should be necessary. Any initiative that is co-chaired by an academic and a politician should really catch your attention, because it doesn't happen that often. Actually, one of the problems we have in our societies is that there is little connection and little dialogue between the scientific evidence that gets more and more complicated, offering more and more opportunities but also challenges in terms of, for example, inequality, and the policymakers who have to take the decisions that will determine how we use science. Vaccination, and influenza vaccination in particular, as the most effective, cheapest, simplest public health instrument we actually have, preventing every year in the EU 2 million people from getting the flu, and we are here signing a manifesto.
It's important for the patients themselves, but it's also important for the broader community to understand the vulnerability of certain conditions.
I'm glad to say that we're starting to see an increase in those vaccination figures coming back up again.
For me, the most important word on that board is the word trust.
So at ECDC, we're responsible for monitoring influenza and influenza vaccination, and I'm an epidemiologist, so numbers matter to me, but I think the numbers for influenza tell a very important story. In a good year, there may be 15,000 deaths in Europe associated with influenza. In a bad year, it could be 70,000 deaths. And although we have targets since 2009 of 75% coverage in many of these risk groups, we know that in Europe we are not achieving it.
Normally, patients trust their doctors or their nurses or their pharmacists. Shouldn't there be more concentrated campaigns on that professional group?
The answer is yes to your question, and I think it's an area that we will be looking at more of. But what we need are sustainable long-term solutions. And for me, one of the big issues is actually building a strong element about vaccinology and public health into the medical training curriculum.
All the member states have, of course, signed up to reach the target of 75% vaccination uptake among the target groups.
It is extremely important as healthcare workers to support a document that highlights the burden of influenza in the different populations, in children, but also in adults, in patients at risk, in healthcare workers and pregnant women.
It's about building trust. It's really has to be about engaging the public, listening to them, listening to their concerns, being there to respond to them, knowing how to respond to them. And we've seen that just providing information is not enough on its own. We need to do that. We need to make sure that the public, healthcare professionals have the information, but we also need to raise trust. And that's not through information, that's through really engagement, listening.